Could you tell us how you know when you're depressed?
Let's see, when I am personally depressed, let's see, I start exhibiting signs of sleepiness. You know, I'm much more tired. Oftentimes I feel as though when my alarm clock goes off in the morning that, oh no, I gotta get up. You know, so I find that I want to sleep a lot. Sometimes I find when I'm depressed that as I'm driving along in traffic, in rush hour traffic on my way home, that sign language isn't working for me, that I want to get out and do something to somebody, you know, and so I see that as signs of not being able to manage my anger. So I know that I need to look at that, and that there might be some underlying depression in there. But also, let's see, the other things that I notice is that I don't have enough energy to do the things that I need to do, you know, to get through my daily tasks, as mundane as they may be. But, you know, I find that I have trouble getting through them all. So that's just a few of the signs that I personally exhibit.
Thank you very much. So, how do you know when you are feeling depressed?
Well, one of the biggest things that leads to depression, that leads to the indication that I'm depressed, is when I get the feeling like the clouds will never break and the sun will never come out. I just have this feeling that it usually starts with getting out of bed in the morning. I just want to keep the covers pulled up over my head and don't want to face the day. I lost that excitement that makes you jump out of bed and say, yeah, let's take on the day. It's more like, no, let's pull the covers back up and hide out for a couple more days. And it's just usually something that comes with state of mind. And whatever kind of state of mind you're in, if you let things get to you, let things pile up, and usually comes with feeling like you can't succeed and take care of business. And so it's just a terrible feeling. I try to avoid it whenever possible.
Well, thank you very much. How do you know when you're feeling depressed?
How do I know when I'm feeling depressed is when I wake up and I literally don't like myself. There doesn't seem to be anything that I can do that makes me happy. And if I'm at home just doing things in the house, I get to thinking of, why am I doing this? Nobody says thank you, when in reality I get a thank you in many more ways than what I deserve. But yet when I'm in that frame of mind, I can't see that point of it. So it's just it's a feeling of not liking myself, and I find myself snapping at things, and then I just want to curl up and go to sleep. And that's how my signs of depression are.
Okay. Welcome back. Well, I wanted to know if either one of you heard anything from our students that particularly caught your attention.
Go ahead, Leah.
Okay, I think a couple of things they said, the wanting to sleep all of the time, the lack of energy, that's something that I hear a lot from people that come in, and sometimes that I experience myself when I'm feeling depressed.
Okay.
That there's a gray cloud and it just doesn't seem to go away.
And you feel tired.
Mm-hmm.
Okay. In fact,
No
people may
energy.
feel tired more than sad, has been my experience. Okay.
Yeah.
Yeah. How about you?
Well, listening to these folks reminded me of just how different each individual person can experience their depression. And even though there are certain checklists of symptoms that we usually go down in trying to make the diagnosis of depression, there's really quite a bit of variability between one person and another.
Okay, so making the appropriate diagnosis is really an art then. It's not as simple as, you know, if you have the 5 following things, then you have depression, because it'll manifest differently. Speaking of checklists, though, let's go back to our graphic and see what the next couple items might be. Let's see, problems with sleep, insomnia, early morning wakening or oversleeping, and eating disturbances, loss of appetite or overeating. So it sounds like at the minimal you're going to see some sort of change in your eating and sleeping.
Mm-hmm. People report that food's not interesting anymore, that they don't have any appetite, or just the opposite. That's what they want to do all of the time.
Okay. So find yourself either compulsively eating or just forgetting to eat.
Mm-hmm.
Okay.
Right, and same thing with sleep. Some people really have a very difficult time falling asleep. Other people wake up frequently during the night or wake up early in the morning and can't go back to sleep. And still other people end up sleeping 12, 14 hours a day when they're depressed. So it really can vary a lot from person to person.
So since it does vary, I guess then again it gets back to how am I feeling, how am I behaving that might be different than I was doing before. Not as much, gee, I'm not waking up early, so I might not be depressed. Okay.
Yeah, you're really looking for a change in how you're functioning in the world and how you're thinking about things. If your thinking is very negative and you can't see the bright side of anything, you're always looking at the glass half empty, but you didn't used to do that, then there's something going on.
Because there's those amongst us, of course, who have always looked at the glass half empty and feel very pleased about that. So I guess that may not necessarily mean depression.
Right.
Okay. In terms of intervention, in terms of saying, you know, helping somebody with this, I mean, how do you assess it? I mean, we mentioned a checklist. What else do you find out about somebody?
When someone comes into my office to have me evaluate them for the presence of depression, I'll ask them quite a few questions about what symptoms they're currently experiencing, how long those symptoms have been occurring, whether there have been any previous episodes of similar symptoms during their life, whether they're using alcohol or drugs, whether they have any medical problems that perhaps could be contributing to the depression, and lots of other questions like that.
That is an incredibly viable point, or vital point, that there could be something physically happening that may not necessarily need to be, you know, popped on Prozac, but actually, you know, you might need to see your physician.
I think there are a lot of illnesses that one component of it can be depression. Things that are going wrong with the thyroid, you might experience depression. Particularly women now, the baby boomers are moving into the premenopause and menopause age, and that again is something that, along with that comes depression. So I think that is a really important point.
And how about, again, you mentioned the presence of alcohol and drugs. I mean, I know that long-term use of alcohol very much looks like clinical depression for a lot of people. The loss of energy and difficulty sleeping.
Right. And one of the interesting issues with regard to chemical dependency and depression is that sometimes it's very difficult to decide which is the chicken and which is the egg, which came first. The abuse of alcohol or drugs can cause depression, and likewise, people who are depressed will oftentimes abuse drugs or alcohol to try to treat their own symptoms.
Okay, so they wind up self-medicating.
Exactly.
This depression. And is it true that if you weren't depressed before and you began drinking and using, if you stop drinking and using, that the depression will still need to be treated? It won't just go away?
Sometimes it will go away, and that's where the art of doing this sort of assessment and treatment comes in. There are people who are drinking and are depressed, or doing drugs and depressed, and if they are asked to be clean and sober from the drugs or alcohol for a prolonged period of time, sometimes their depression will clear up on its own, although there are some people whose symptoms will continue, and those are people who probably should get treatment for depression.
Absolutely, because my experience is that one of the causes of relapse for alcohol and drug recovery is the fact that this kind of clinical depression surfaces, and the person says, well, gee, you know, if my recovery's not working for me, I'm going to meetings, I'm working with a sponsor, I still feel as bad as I did when I first came in, and that's the time when somebody needs to get maybe an evaluation and some more help. Let's take a look at our final symptoms that we had in our graphic. Difficulty concentrating, remembering or making decisions, or inappropriate feelings of guilt. I don't know which of you would like to speak to those issues.
Well, I think the inappropriate feelings of guilt is a good one, because I think people, again, feel badly about things that they've done and feel like it's all their fault when they're depressed, and that may not, again, their thinking is out of whack.
Okay, so it's almost like when I'm depressed, in some ways I become the center of the universe, in a sense that everything must be my fault. And
That's right. Sometimes people feel guilty even for things that obviously could not have been you know, their responsibility. For instance, I had an elderly woman who was a patient who was convinced that her husband was going to lose all of their money because of the fact that she was depressed, and she couldn't explain how that would happen, but she still felt guilty that it was going to be her fault.
Okay. So the kind of people get on a track in terms of their thinking, and it's very difficult to interrupt it.
Sort of a tunnel vision.
Kind of tunnel vision, that's right. Okay. They also talked about difficulty concentrating. Is that something you've noticed in the clients you've
I have
worked with?
people who come in and say, I can't seem to focus on my work, I can't get the job done, my boss tells me to do several different things, and you know, unless I write them down, I'm going to forget them, and it just seems to take me a lot longer to do them.
Now, we're going to need to close here in a minute, but I do want to mention quickly that, Leah, you do have a depression recovery group. That's my understanding? Okay, and I know that you, Dr. Kriegel, do assessments and would be a good person for people to check in with if they feel this is going on for you.
Sure.
Okay. Thank you for joining us tonight on Bay Area Psychology. Next week, we'll learn more about children of divorce. Just how resilient are they? I'm Mary Crocker Cook. Good night.